I'm really excited to introduce our next speaker, Dani Jones, Chief Strategy and Partnership Officer at Alder Hey Children's NHS Foundation Trust. Dani leads Alder Hey's award-winning Vision 2030 strategy, which is generally shaped by children, young people, families and staff, and supported by advanced analytics. It's actually been my personal career highlight to work with Dani and the board on this journey. And I'm delighted that she's going to share some of the story with you today. So over to you, Dani.
Oh, thanks, Naeem, and thank you, everybody. Thanks for having me. I've got a really fun job, I think, at the end of these amazing presentations today, because I get to think about practical application of what people have been talking about, and there's so many common themes in this. So, I'm going to talk a little bit about children's voice, talk a little bit about children's data, and I'm going to talk a little bit about children's architecture, so that we share some of the experience we've got, really, that may be useful for others. And indeed, I know I will be learning from others, as I always am as well. So next slide, please. I think the first thing I wanted to say is that we can and should live and breathe building children and young people's voice into everything that we do. It is our job as adults in power to listen properly to children and young people. It is our job to engage well. It is our job to make the world a place where children and young people's voices can be heard and they can influence their own services. And Maya Sola put that more beautifully than anybody else could. We do live and breathe this. There are some really practical ways to do that. We've got some fantastic. We take a rights-based approach. I think people will be very familiar with that. We design our models and our clinical services around children's feedback and have learned some really interesting things. So we've done some big pieces of work around closed-loop technologies, for example, for diabetes, where children need the use of their phone. And they said to us, we need you to help us describe why we need the use of our phone in school, because we're not allowed our phone in school, but of course they monitor their blood glucose and various things through their phones. So we've done some practical work on that. We asked kids with sensory needs about our hospital and their experiences of coming into the main building, and they did not like the atrium here because it's big and noisy and smelly. And we all panicked thinking, oh my goodness, how are we going to address those needs? And actually they said, you don't need to panic, just give us some ear defenders and a pair of sunglasses. So there's some really simple, practical, if you ask children and if you're willing to listen to children and young people, you will get some really simple, practical suggestions of how you can mitigate some of the challenges. We also work with children and young people in recruiting our leaders, and I have worked with young people as a panel for all of our senior leaders, and I've got 100% hit rate of them picking the successful person. So have faith in your children and young people. They are very, very able. We also anchored, as Naeem said, children and young people's voices firmly in our Vision 2030. So the sunflower that you can see there is our plan on a page. We talked to literally thousands of children and young people, and what they told us was they wanted us to get them well. They wanted us to personalise their care. They wanted us to bring the future, and they wanted us to help improve their life chances. And those things came over in a very, very strong way. And we've organised our strategy around that. So I can tell you a little bit more about that as we go on. And then things that have already been said actually over the course of today, but we've done widespread rollout of Lundy training, for example. You've heard from one of our child health equity champions. We're part of Cheshire and Merseyside, we're the children's lead for Cheshire and Merseyside in that health equity collaborative. And then also we make sure that we've got youth forums and community voices at every level of our governance. And that can mean organising your meetings at different times. It can mean working around children and young people. It means all of the adults in power being prepared to change what they're doing in favour of hearing from children and young people. Next slide, please. The next real challenge, I think, in our system is that children and young people's data is poor compared to what we know about adults. There are very few child-specific indicators nationally in terms of data collection, and lots of them don't break it down by ages and stages. So you don't know what's different in terms of the diagnostic tests that are being undertaken for the under 5s than you do for the under 12s, than you do for the under 18s, and those cohorts are different. They look and feel different. So it's really important to find out what matters to children and young people and measure it. And the Health Equity Collaborative, as aforementioned, is a really good example of a way of doing that. We've also done quite a significant piece of work on population segmentation through our Vision 2030, as I said, and asked children and young people what matters to them through different lenses. And what we learned was that for kids who predominantly know us in Alder Hey through a Get Me Well lens, i.e. they've got quite a quick fix. What they're interested in is fast access, being, the digital access, speaking to some of the points that Marisola was making before as well. And actually that's really different than kids who want us to personalise their care, the ones that we have a very long-term relational, we know them sometimes from when they're fetuses right through to when they transition into adult services because they've got long-term complexities. What they want from us is different. And so what we learned and what we do is talk to those cohorts of children and young people about what their wants and needs are through a cohort lens rather than taking a blanket approach. And we find that gives some really positive outcomes. And then finally, I think there's something really important to say about lobbying. If you're going to take the time, and you should take the time to talk to children and young people about what matters to them, we then need to work on how we lobby to get those things standardised nationally. We've got we shouldn't take no for an answer around differences in age specific fields. On national data returns, we shouldn't take no for an answer about finding new ways to measure what matters to children and young people locally, and they should carry equal weight in terms of how we measure ourselves against our service delivery. Next slide, please. And I suppose the third bit, in practical terms, we need to build and construct the right children and young people's architecture if we're really going to rewire the NHS around children. It's really hard to do because usually children are an addendum on the end of a very long, complicated adult agenda. That's far too common in our systems. And so what we've done locally, and it may be of use to others, is we've really put forward our leadership for children and young people. We've been, we are in Alder Hey considered to be a trusted convener for children. That's a real privilege. We've also sought out and found some really brilliant, passionate advocates. So the chair of the ICB here in Cheshire and Merseyside has been an absolutely superb advocate for children. And you need to find those advocates and use them and work with them and make as much noise about children in the most productive and positive way that you can and centralise children's voices in that. We also lead the Transforming Children's Services programme. We call that Beyond. In fact, it was children and young people who call it Beyond. They didn't like being called a transformation programme, and for obvious reasons. And that is really making sort of significant measurable impact in everything from, shift left priorities, obesity, oral health, right through to some of our really, much more specialised end of care from epilepsy and so on. And everything in between. But the real message is to let the delivery do the talking. I think when I started in Alder Hey 7 or 8 years ago, there was still a sort of a tail end of people saying you must listen to children, but not really being able to back that up with some of the brilliance. I think what we've done in the National Children's Transformation Programme, and certainly in Cheshire and Merseyside through Beyond, is be able to add substance to that delivery and measurable impact, which is key. And then make the governance work for children. It's really hard. You have to sort of battle everything that's, you have a planned care work stream, you have an unplanned care work stream, you have a this, that, and the other, and they all have a little bit of kids. And what we said is, no, we need to pull together around children. We also designed that very, very carefully so that it was with local authority representation, children and young people's voice, voluntary community sector, primary care, all of our NHS partners. So we've got a real whole system view of children. And that's so important because children don't live their lives in health services. They live their lives, or hopefully live their lives, in schools, or they live their lives in community centres. They live their lives with their families. So organising ourselves to reflect that was really, really key. And we want to keep our aspirations really high for children, right? Absolutely right that we think that there should be amongst the first integrated health organisations in the country as a result of the 10-year plan. Absolutely, there should be one that prioritises children and really thinks about keeping those aspirations right up top for what we can achieve by bringing together outcomes for children, thinking around life stages rather than service lines, and really anchoring in that health education, community and opportunity. Next slide, please. So we think success looks like creating a system where children come first. And, to do that, we need an integrated health organisation. To do that, we really need to prioritise faster access and reduced waits, really cracking through how we deliver better experience and have a workforce that really feels that and really feels able, enabled and empowered to put children at the heart of how they design their working day and therefore the services with children. And we know the opportunities around a more sustainable NHS. Naeem outlined them beautifully at the beginning. This is an economic imperative, not just a moral one. So fundamentally, we want to have a world-leading NHS for children. Thank you ever so much for listening.